Hello, everyone. Good afternoon. Buenas tardes. Boa tarde. Thank you for joining.
Priscilla, you're accidentally muted.
Yes. Lynette, please do not mute me, my dear. I don't know if you're muting me. I know I asked your help. I ask your help, Lynette, please helping me to admit people that are on the waiting room as I am presenting the first slides. Thank you. Sorry, everyone. So welcome again. Good afternoon. Boa tarde. Buenas tardes. Thank you for joining us today. We're going to start our session today in the name of the National Latino Behavioral Health Association, the National Hispanic and Latino Addiction and Prevention Technology Transfer Centers will welcome you. My name is Priscilla Giamassi, and I am the project coordinator for the National Hispanic and Latino PTTC. Welcome to the third session of a four-part series titled Accelerating Training in Behavioral Health Equity, a learning series for trainees. I will be your host for today's session. Before we start our presentation, we will share with you some important information. Here is some data about our grant. You're going to receive a copy of this presentation so you can read the content at your own convenience. The session will be recorded and archived for future playback. A copy of today's presentation will be also made available. The lines will be muted throughout the presentation so as to minimize background noise, but we have opportunities for you to exchange ideas and to participate with us. When we get to the Q&A portion of our session, you will have the opportunity to ask questions to our presenter, and we will share with Dr. Sampilo. We'll also be asking you to fill out a brief survey at the end of this webinar. The satisfaction evaluation is very important for the work that we do and provide us the opportunity to improve our training efforts. Closed captioning is available for this event. Please let us know if you need any help to enable closed captioning for you. A certificate of completion will be sent to you via email after today's session. And we are going to ask you to rename yourself using some codes in the next slide, so please bear with us. On the next slide, we just want to take a moment and reflect on the power of words. We are all prevention leaders in our teams, in our community, and in our field, so together we can use words to create positive change. Here's the TTC network map with information about the addiction, prevention, and mental health technology transfer centers. Each network is comprised of 10 regional centers and 3 national centers, the networking coordinating offices, the National American and Indian and Alaska Native TTCs, and also the National Hispanic and Latino TTCs. Our center has a national reach for the Hispanic and Latino communities and the workforce that provides services to these communities. Please allow us to introduce you our parent organization, the National Latino Behavioral Health Association, NALBA. NALBA is a nonprofit located in New Mexico with the mission to influence national behavioral health policy, eliminate disparities in funding and access to services, and to improve the quality of services and treatment outcomes for Latino populations. NALBA's priorities are selected capacity expansion of mental health services for Latinos, Latino behavioral health evidence-based practices, legislation to increase the number of behavioral health professionals, funding for co-occurring disorders of alcohol and substance abuse, opioid crisis in the Latino community, and suicide prevention. I also want to take this opportunity to invite you for the 2022 National Latino Behavioral Health Conference, Latino Behavioral Health Equity, Juntos Podemos. It's happening in September 15 and 16 at the Sahara Hotel in Las Vegas, Nevada. This conference will provide a forum for behavioral health professionals from different areas to connect, exchange ideas, and together explore best practices to attend the Hispanic and Latino communities. We are sharing the link in the chat right now, so we hope to see you joining us in person. We're preparing an amazing event for you, and Dr. Sampilo is also one of the presenters. This is our team. This is the National Hispanic and Latino ATTC staff. Dr. Suzy Villalobos is serving as the project director. We have Raquel that joined us last week as the co-director, and Anna is working as the program specialist. On the next slide, we have the PTTC staff. We have Dr. Susie Villalobos also serving as the project director for the PTTC. I'm working as the project coordinator, and I also have my colleague Christina as the program specialist of our center. Now I'm going to introduce Dr. Sampilo for those that were able to join our sessions 1 and 2. I'm sure you already got to meet her a little bit and understand why I think she is one of the best people in the world, but I want to read her bio so you can have more information about her background as well. Dr. Sampilo is a clinical psychologist who specializes in integrated behavioral health and health disparities among diverse and marginalized populations. She received her doctorate degree in clinical child psychologist from the University of Kansas, a master of public health with concentration in social and behavioral aspects of public health from the University of Kansas Medical Center, and an executive certificate in social impact strategy from the University of Pennsylvania, all of which allow her to develop extensive experience in prevention, health promotion, and intervention for diverse populations, particularly the Hispanic and Latinx population. Dr. Sampilo is also well-versed in public policy from her tenure as a health equity and cultural competence administrator at the state level, where she led the agency's behavioral health equity initiatives and consultant with state agencies on issues of equity and diversity, especially related to racially and ethnically diverse immigrant populations and refugee communities. She is currently a psychologist in the Center for Pediatric Behavioral Health at Cleveland Clinic, where she works in integrated behavioral health within primary care. She currently serves as the Health Equity and Social Justice Lead for the center, and she is also chair of Diversity, Equity, and Inclusion in the Pediatrics Institute of Cleveland Clinic. She also works with various local, state, regional, and national entities on training and professional development in their areas of equity, diversity, and cultural proficiency. Dr. Sampilo, is always a pleasure to learn from you. Thank you for being here with us today, and please feel free to start your presentation.
Awesome. Thank you so much, Priscilla. And just thank you again to the ATTC and the PTTC and NALPA for all of the good work that you guys do. I will go ahead and start today's presentation. So this is session 3 of this 4-part series. So thank you all for being here. Couple of things I just want to go over. I want to ensure that I do my land acknowledgement prior to my presentation today. So I'm delivering this presentation on the lands of the Erie, Kaskaskia, and Mississauga people. They were the traditional owners of the land upon which Cleveland Clinic Children sits, which is where I currently work. And I want to acknowledge their history during our presentation today and their enduring presence as well. I also want to provide a link to a 4-part documentary series on Native people within the United States. It's actually a really good 4-part series documentary done by PBS. So there's a link here in the slide where you can learn a lot about the history and sort of the current struggles that our Native people are still, the fights that they're still trying to fight currently. So I highly recommend that you check that out as well. All right, so just a few housekeeping things. Obviously, disclosures, I have no conflicts to disclose. And then to help us with sort of the interactive portions of today's presentation. So we will have some breakout room activities in order to provide a good forum for everyone to be able to interact and engage with folks at a similar training level. We would like you to try and rename yourselves within your Zoom account. So if you're able to rename yourself and just add either an A, B, C, D, or E based on the categories here at the end of your name, that will help Priscilla and her team assign you to the appropriate breakout room. So again, if you fall in the undergraduate or post-baccalaureate level, please put an A after the end of your name. If you're a graduate student, so currently in a master's or a doctoral program, please go ahead and mark B. And if you're currently on residency or internship, C. If you're a postdoctoral fellow, D. And then if you are licensed staff, full-time staff, faculty at an academic institution or hospital or behavioral health agency, please go ahead and mark E on your profile. Again, the reason we do that is just so that we can ensure that folks are sort of grouped with folks who are at a similar training level, which will help when it comes time for the breakout rooms. So I'm going to give you just a moment or two to go ahead and work on doing that. I really do appreciate that. Again, it really helps the team just assign folks efficiently and ensure that we capture your training level and assign you based on the appropriate training level. There are some instructions also in the chat for how to rename yourself in Zoom. And if for some reason, folks come on late or what have you, and they don't rename themselves, we'll figure it out on the back end, but this just sort of helps us assign groups from the get-go. Really appreciate all of your cooperation with that. Again, I'll give it about a minute just so folks have a little bit of time, and then we will continue with the presentation. And again, your categories are there on the screen, A, B, C, D, or E. And I can actually see the letters popping up in the chat. So I appreciate that for you all, or I'm sorry, on your profile for who's in the audience today. So really appreciate your cooperation. All right, so I will just go ahead and start the rest of the presentation today. So again, just in terms of like our key objectives here, we are going to define key social justice concepts, outline how they're related to equity, and then discuss the applicability of key social justice concepts for individual reflection and intervention. That's going to be a large part of what today is about. Because if you recall, at the end of session 2, we talked about sort of what is the first step in applying social justice to behavioral health. The very first step is doing our own individual education, reflection, and interrogation. And so that's what today is going to be really focused on. All right, so just again, framing discussions of oppression and racism have been emotionally charged. And again, a lot of that has to be how we are socialized to not really talk about these issues, but we can't really confront these issues if we don't talk about them. So I just want to sort of lay that out there. We all are going to have different experiences with these topics, particularly with the concepts we cover today, which will be a lot about our identities and social positioning within our society. With that in mind, our identities definitely have impact and influence on our experience. So today is about recognizing, reducing, and preventing harm. So we're going to try and think about things differently, and then in fact, try and do things differently. And that's the way of recognizing, reducing, and preventing harm. We may experience some discomfort when discussing these subjects. That would be normal. But again, most of that is because of the way we've been socialized to avoid talking about some of these issues. So with that in mind, just some general guidelines for today. Consider discomfort as the price for growth, and that growth that leads to opportunity. Consider how we could respond to things differently, how we can change or grow, and how we can respond to calls for change. Pay attention to your own reactions and reflections about what might be causing them, so you can do that reflection as we talk today. And avoid judging others' experiences, mostly focus on your own and kind of consider your own experiences in this work today. So with that in mind, we'll go ahead and get started on today's content. So really, when we think about critical social justice, which is really what we're talking about, we're sort of underlying this framework or sort of these primary tenets that society is basically stratified along social group lines. Society is essentially stratified according to power dynamics and according to systems of power and privilege. And as a result, social injustice results in unequal access to resources and opportunities between groups of people. So because of the way society is structured, it does result in unequal access to resources and opportunities for certain groups of individuals. And by recognizing the relations of unequal social power and that they are constantly enacted at macro levels, we can begin sort of that process of deconstructing those systems. But we first have to recognize them, and we first have to acknowledge them. Inequality is deeply embedded and entrenched in the fabric of society. So those systems, the power dynamics and the systems of power and privilege were created to maintain some folks in power while also disadvantaging others. And so as a result of that and sort of the structural inequity that's sort of embedded into these systems, in order to really challenge them, we have to do some self-reflection. It sort of begins with our own internal work, which is a lot of what we're going to focus on today. So we're going to do some self-reflection about our own social location and act from that awareness in ways that challenge social injustice. So really what I'm asking folks to do at the end, by the end of this session, is to really talk about things differently, think about things differently, and think about our own attitudes and biases. And sort of moving from here, how do we work from that space in order to really challenge social injustice within behavioral health and sort of within our daily lives too. So those are sort of the tenets or sort of the primary underlying principles, if you will, when we talk about critical social justice. So part of critical social justice really, again, focuses on the starting place is really focusing on self-reflection and understanding our own identities and sort of where we sit in society. So we're going to talk a little bit about identity now. So what we know is that groups are born into or develop membership into a social group, and how you are sort of a part of social groups is sort of important because it's how you make sense of your world. Who you are socialized, or what groups you're socialized into, and who you socialize with, you develop certain understandings and how you and perceptions of the world from those social groups, right? Any social group that you belong to, there's generally perceptions or sort of attitudes that you may learn either from what those other individuals say, how they act, how they behave, so sort of through modeling. And so we take in the learnings of the different social groups that we belong to. One of the things, or one of the key things that we learn, is we learn what a social group is and what a group is not. So we also learn a little bit about the in-group and out-group sort of dynamic, who fits in our social group and who doesn't fit in our social group. Again, just by nature of belonging to different social groups. So here are some of the, and this list is not exhaustive, so I want to make sure that I clarify that. So groups and identities listed here on this table are not exhaustive. So by group, we have sort of the different social groups based on sort of that category, either race or race detail, ethnicity, class, gender, sexuality, religion, ability, nationality. Again, not an exhaustive list. There are a lot of other social groups that could be included here. And then you have group identities as a function of that group. So and those identities that are listed here, also not exhaustive. So there's a ton of other identities that can fall within within the identity list. But this is just to kind of give you an idea. So when we think about a social group, we're thinking about the broad category, sort of the umbrella category, and we have an identity that is associated with that social group. And again, not an exhaustive list. So you may find that as you read, you may fall into one of these categories or lists. And in other cases, how you would identify is not listed here. And again, that's because this list just is not exhaustive. But this is just an idea of sort of those social group categories or social group memberships that we have. Okay, so what we're going to do is we're going to actually start into our own breakout room. So what I want us to think about, and we're going to do a little bit minute of instruction, and then we'll sort of send you to your breakout rooms. But one of the things is to consider the social or group identities that you hold. And again, you don't have to go by that list, but I just want folks to be thinking about this. Think about the identities you think about most often. So of the identities that you hold, or the aspects of identity that you hold, which ones do you tend to think about most often? And think about also the identities that maybe you think about the least, or aspects of your identity that maybe if you were filling out one of those like social identity circles or social identity wheels, would be the ones that maybe you don't necessarily think about as often. And what might you think more, or why might you think more about some of your identities than others? So start to reflect on why maybe some aspects of your identity are more salient or come to the surface more for you, while other experiences may lead you to think about some of the identities that are less salient for you. So just sort of reflect on that. And again, you can only have to share with your group what you're most comfortable doing. If you want to just share one answer to one of these, if you want to just share a general reflection, that is okay. You do not have to follow the script that's laid out here. The general idea is that we just sort of have an initial discussion about social identities within your group. So Priscilla and team has worked really hard to try and assign you to different breakout rooms. Again, you will generally be paired with folks that are at your training level. If there are folks who are not at your training level, if you find yourself in a group and you're like kind of like the outsider amongst all of the members, if you're the only like faculty and a member of trainees, go ahead and leave your group and we can like reassign you, not a problem. All right, so with that said, we will do this for about, let's do this for about 10 minutes, Priscilla. And that should give you all a chance to have some discussion amongst yourselves. And again, only share what you're most comfortable sharing with your group, do some introductions, and then kind of go into the exercise.
Thank you. We're going to open the breakout rooms now. If you're not assigned to any room, you're going to remain in the main room, and we are going to let you know which room we're going to assign you to. So thank you. Hope you have a good time with your colleagues. You all should have received a message from Zoom inviting you to join a room. Hope you can go there. Let us know if you have any questions.
So Thank you, Priscilla. I apologize for that. Yeah, so just sort of understanding that your perspective is influenced by position in society, and it influences what you can see, what you can understand, and again, what you can't see or what you can't understand. So when we think about positionality, we really have to think about the systems of power and privilege, or power and oppression within our society, because that dictates a little bit of the impact of positionality, right? So prejudice and discrimination are dynamics that occur on an individual level. But oppression is really about prejudice and discrimination that's backed by power, meaning that you hold, or that system holds power to disadvantage some and advantage others. And so thinking about the difference between prejudice, discrimination, and oppression happens to be focused, or centrally focused, on power and the ability of power to have an impact on those systems. So racism is one form of oppression. So when we think again about power and oppression, just distinguishing between oppression, discrimination, and prejudice, prejudice can lead to discrimination. Prejudice plus power, however, is oppression. So you can think about that as just the distinction between the two. When we talk about oppression, we're really talking about oppressive systems and oppressive structures, right? Systems that have been built or designed for certain individuals to have the preponderance of power within that system, and then to maintain power within that system among those individuals, right? So that's when we're talking about oppressive structures or oppressive systems, because they've historically been designed that way and they're maintained in that way currently. So when we think about understanding power, you can think about sort of power as being distributed, or sort of thinking about it across agent and what we call agent groups and target groups. So essentially folks who have the power in that system or that structure, and then folks who generally do not have the power. So agents are going to be members of your dominant social groups. So the way Amani, I think, sort of described it as the majority, if you will. Like sometimes we don't think about our majority identity, and oftentimes the majority happen to be the dominant social groups. That's not always the case, but that is often the case. And those are the members of the dominant social groups who have or maintain an unfair advantage over other groups. Targets are your members of social groups who have an identity that's a part of the target group, who generally experience either historically marginalization or currently, contemporarily also experience marginalization. And they may also experience a disenfranchisement by an oppressor or oppressor systems or institutions. So really thinking about sort of the groups, again, agents who have the power within that structure, and then the targets are members of the social groups who generally don't hold power within that system. So why is it important to understand a little bit more about agent groups? Agent groups really have, because they power is clustered among agent groups, they have the power to set, define, and really determine policies, practices, and procedures that, again, generally maintain a certain level of power among that group. They can also impose aspects of their culture upon the target groups, or sort of the minoritized or marginalized groups. If you think about sort of the history of oppression and power, think about colonization. And so individuals who belong to agent groups can engage in colonization, which then causes sort of the target groups to internalize aspects of the colonization. And then they maintain their advantaged social positioning due to systematic and institutionalized unequal treatment. So again, thinking about groups who generally have traditionally held power, who then maintain power by creating systems or policies or procedures that, again, continue to cluster power among that select group. So how does it occur? It occurs across levels. So if you think back to session 2 of this learning series, we talked about systemic racism. We talked about racism occurring at the individual, interpersonal, institutional, systemic, and then structural level. And that's really how oppression also occurs. So you replace racism with another oppression, really talking about like your isms and those kinds of things. It filters through all of those levels in a very similar fashion. So again, just sort of to review, this was the example that we sort of shared last week when we talked about racism as a system of oppression, structural, systemic, institutional, interpersonal, and then the individual levels. I won't go through all of these categories again, just because we covered it in the last week, but it's just, again, sort of a figure or schematic of how racism really filters through all of those different levels, and how really any oppression replace racism with another oppression, and it will filter through those levels as well. So this is sort of your new table, right? So we talked a little bit about just social group membership and social group identity. And now we're talking about oppression, and then the the distinguishing between your agent groups and your target groups. So in this table, your oppression is sort of listed in the middle, or the system of oppression is listed in the middle. On your left-hand side, or if you're staring at the slide, it's on your left-hand side, you have generally considered the groups who are considered your target groups or your marginalized groups within that system. And then on your right side, you have the individuals or the groups that tend to be viewed as holding the power and generally hold the power in those different systems. So your dominant or your agent groups, right? So when we think about racism as an oppressive structure, as an oppressive system, we think the dominant group or the agent group, the individuals who hold the power within the system are white, non-Hispanic individuals, people of color, or BIPOC individuals tend to be in the target group. Same thing, if you sort of go all the way down, you see sort of who we traditionally see as holding power and who we view as not necessarily having power within the system or structure, and who experience the negative consequences of oppression and oppressive systems. So when we think about power and oppression, we have to think about privilege. So when we think about privilege, privilege is unearned access to resources, and key is their unearned access that's readily available to individuals solely based on their social group membership. So it's an advantage or an immunity that's granted to or enjoyed by one societal group above and beyond others. And it's privilege that is often invisible to those who have it. So that's an important note. So essentially, when we talk about privilege, we're talking about accessing or sort of having an advantage to access resources and supports solely based on your position or solely based on your social group membership. And again, the reason that that exists is because within our systems, we do cluster power with certain groups and other groups don't have power. And so by virtue of that, privilege is afforded to some individuals and other individuals don't hold that same privilege. It's important to note that, again, privilege is often invisible to those who have it. So I think it's important to get back also to Amani's point about when we are the majority identity, maybe that isn't as salient to us. When we have privilege, we don't always see it. It's not as salient to us as having privilege in those particular circumstances. So this is actually one of the seminal articles about privilege. So Peggy McIntosh in 1989, I'm sure a lot of you are probably familiar with this article. She wrote The Unpacking the Invisible Knapsack, and the invisible knapsack was meant to sort of be a symbol for the burden that individuals experience when they experience oppression or don't have certain privileges. So she basically sort of talked about privilege as a concept and then went into examples or items, if you will, that sort of describe what are some things that may not occur to a lot of individuals because they have privilege, but for individuals who maybe don't have the same experience, who don't hold privilege due to whatever aspect of identity, they may not have that same experience. So for example, we're going to go through just a couple of examples. One of the examples that she listed was, I can, if I wish, arrange to be in company of people of my race most of the time. And that is something that I think we don't necessarily think about, again, when we are part of the majority. But if you feel like, and you are one of the few individuals who represent your racial background in an environment, it likely would stick out to you, right? You likely would notice that more. You also, if you're able to even have that experience, some people may not be able to have many opportunities for that experience, where generally they are one of the few belonging to their racial background in a group of individuals who they don't share the same racial background with. So if we want to think about that, we're in behavioral health. So for a lot of graduate programs, the experience, I know this was my experience, was an experience of not necessarily being around a lot of individuals who shared my racial and ethnic background, not having a lot of professors who shared my racial and ethnic background. And that was a lot of my graduate school experience. So how do you then think about that when it comes to the perspective that other individuals may have? Because again, when we think about privilege, we're thinking about our perspective, we're thinking about our attitudes and our biases that may be a result of not even recognizing some of the privileges that we hold. So another item she mentioned was, if I should need to move, I can be pretty sure of renting or purchasing housing in an area which I can afford and which I would want to live. So essentially, you sort of go through some of these, and these are just a sample of some of the entries in her article. But you think about, is that something that I feel like I can do? Is that something that I feel like could be my experience? And depending on how you answer that, you may decide, or you may reflect on or understand that you hold a certain level of privilege that others don't, and that you may experience the world in a way that others don't because of that privilege. So again, some other items, I can be pretty sure that my neighbors in such a location will be neutral or pleasant to me. I can swear or dress in secondhand clothes or not answer letters without having people attribute these choices to bad morals, poverty, or the illiteracy of my race. I can go shopping alone most of the time, pretty well assured that I will not be followed or harassed. I can turn on the television or open to the front page of a paper and see people of my race widely represented. When I'm told about our national heritage or about civilization, I am shown that people of my color made it what it is. So thinking about like history. And I can be sure that my children will be given curricular materials that testify to the existence of their race. So when we think about even behavioral health, if you think about just sort of thinking how this might apply, so even saying like, do you have materials within your waiting rooms in your behavioral health organizations that demonstrate to children that that's reflective of their race, right? That they're a part of the resources within your institution or your agency, right? They may not be reflected in some of those resources, whether it's coloring books or what have you. They may not be reflected in some of that. And so even just thinking about that in terms of how we might apply some of this to behavioral health. So Romano actually took this, the Invisible Knapsack article by McIntosh, and sort of decided to apply it in medicine. And the reason I bring up this particular article is because I do know a lot of the trainees currently on this call and in this series are in graduate school, either master's program or doctoral program for psychology or behavioral health or social work in some capacity. And so thinking about systems that may approximate what higher education looks like. And so medicine may be a close proxy for higher education in some ways. And so Romano really took some of these items and tried to apply them to like academic medicine. So what someone might experience in the academic medical center world in terms of the idea about privilege. So I really like this article because he just takes it and applies it to academic medicine, which in and of itself, we know historically is traditionally a system where power is clustered among the majority is white males, generally speaking. And so thinking about how this may apply in academic medicine. So some of the items on Romano's list I have been taught since an early age that people of my own race can become doctors. Throughout my education, I could succeed academically without people questioning whether my accomplishments were attributable to affirmative action or my own abilities. During college and medical school, I never struggled to find professors and academic role models who shared my race. So again, for those of you who are currently in graduate school on this call, you would just sort of replace medical school with graduate school, kind of see how maybe this feels for you as you read this. When I applied to medical school, I could choose from many elite institutions that were founded to train inexperienced doctors of my race by quote unquote practicing medicine on urban and poor people of color. When I walk into an exam room with a person of color, patients invariably assume I am the doctor in charge, even if the person of color is my attending. If I respond to a call for medical assistance on an airplane, people will assume I am really a physician because of my race. And every American hospital I've ever entered contained portraits of department chairs and hospital presidents who are physicians of my race, reminding me of my race's importance since the founding of these institutions. So for those of you who don't necessarily work in academic medicine, a lot of academic hospitals have like a hallway or some part of their building or institution where they do pay tribute to their past chairs or past presidents or past CEOs or whatever leadership position. And you generally will see a hall of portraits, and they generally do tend to be white males. Even if I forget my identification badge, I can walk into the hospital and know that security guards will not probably stop me because of the color of my skin. So these are just sort of the examples that came out from the Romano article. Again, I definitely can recommend, and I can actually put them in the chat, as we go through this series, and sort of maybe while you're in the breakout room, I can throw in the articles so that you all will have access to them. But I think it's important to sort of understand the concepts that the authors, either McIntosh or Romano, are trying to put forth, is that generally speaking, we don't think about the privileges that we hold. And as a function of that, we don't necessarily see we don't see the disadvantage, or we don't see the oppression that other people experience within our systems, right? Because maybe you answer yes to the majority of these items or the majority of these questions. So then if you do answer yes, are you seeing maybe what the experience is for other individuals? And if in your own life, if you can see that experience, or you can sort of understand that experience, that's important to understand from your perspective in terms of being a professional or becoming a professional, right, in this space. Because behavioral health historically also functions very much like academic medicine, in that it's a system and a process, it's a system and a process that's designed with certain with certain individuals or groups in mind. It's not a system that's built for everybody just yet. That's why we have inequity. And so thinking about our own identities, thinking about our own privilege is the first step to really trying to reimagine that system. So that's why you focus a lot today on self-reflection of our own understanding of privilege and identity in our own world. So that gets us into breakout room number 2. So what I'm going to do is, before I let you all go into your breakout rooms, I'm going to ask you all to take a picture of this slide, because I know I didn't have you do that the last time, and you won't necessarily these questions when you enter your breakout rooms. We're going to shift you to your same breakout. And if you missed the first breakout room option, just stay in the main room and we will assign you based on your level of training. But I want you to take a picture of this slide, because these will be the guiding questions. And again, they're just guiding questions. So you don't necessarily have to answer these questions. You can just talk about the concept of privilege, or really just the things that we talked about in general. But I want you to consider the concept of privilege. And what are one or more ways in which you have unearned disadvantage in your life? What are one or more ways in which you have had unearned advantage in your life? And what is it like for you to sit here, talk about, and hear about the experiences of unearned disadvantage or advantage within your group? So again, only share what you're most comfortable sharing, but we'll go ahead and break you out into groups. And Priscilla, let's bring them back at 3:08. So we'll give you about 12 minutes in this group. And then we'll bring you back, and then we'll move on with the rest of the content. But again, take a picture and then we'll send you to your groups. Thank you, Priscilla, for setting the recording again. So when we think about interrogation, really what we're talking about is critically asking ourselves some very critical questions. How do we uphold oppression, or whatever form of oppression, whatever oppressive system we're talking about? How do we uphold racism? How do we benefit from racism in some ways? How do we benefit from heterosexism, ableism? How do we benefit from maintaining the status quo? And I think that's really important, is that last question, is because generally speaking, we all likely in some way, shape, or form, many of us benefit from maintaining the power structure as it stands in some way or form. And part of that is, again, by design. It's meant to advantage some and disadvantage others. And so by virtue of that, some of us benefit from that system. And so thinking about, in what ways do I actually benefit from that? How can I be tangible and concrete about that and really understand that and reflect on that for myself, is sort of the first step in learning to dismantle that system. Because if you can be honest with yourself about ways you benefit from the system as it stands, then you can really think about, how am I going to engage to deconstruct the system? Because even so, I benefit from it as it is. And letting go of that benefit and letting go of that power in some ways is critical to the work that we're doing. It's important to understand that any individual can simultaneously experience privilege and oppression. So this gets into the concept of intersectionality, which was coined by Kimberly Crenshaw in 1989. She's a legal scholar, fantastic, just scholar around all of these topics. And what she really, how she sort of came about thinking about this concept was the struggle of Black women. And she coined intersectionality to help explain the experience of Black women, and how that they have an experience where they experience oppression within power structures that interlock or interconnect to enact and really impede their experience, right? So it creates this unique barrier that Black women face as a result of the interlocking or intersecting of those oppressions. So when we think about, again, we go back to sort of our second table regarding who are our target groups, who are our agent groups. Now, when you look at it, you can kind of see, well, I fall maybe in the target group in some ways, but I fall in the agent group in other ways, right? As I sit here, I know that there are aspects of my identity that are in line with the target group or historically marginalized and minoritized individuals. But there are also aspects of my identity that put me in the dominant group in some ways. And so it's important to understand you can simultaneously hold privilege and experience oppression as well at the same time. So the importance of intersectionality is that you can't understand true social inequality if you don't understand if you try to understand it just by looking at social categories in isolation, right? To really think about and really understand social inequality and really try to eliminate or dismantle social inequality, you have to understand the intersectionality of the systems. And so if you think about pay equity, for example, we know that women of color, well, first of all, we know that women don't make the same amount of men. They're not paid on cents on the dollar equivalent to men. That's women in general. We also know that women of various racial and ethnic backgrounds don't make the same as white women in terms of cents on the dollar. That's why we have like Latina Equal Pay Day and so forth. it's important to understand that, because we only fight for pay equity generally, we only fight for pay equity broadly, and don't attend to the struggles of other individuals or other groups within that structure, within that system, that are experiencing unique oppressions as a result of intersectionality, then we won't necessarily develop policies or procedures that benefit all. We may benefit some part of that group, some part of women, or some groups of women, but we're not going to benefit them all. So we have to think about that broadly. So again, thinking about intersectionality, and reflect on where you hold maybe marginalized identities, but also belong to more of the dominant groups as well. And so really thinking about intersectionality and really thinking about oppressive institutions, we have to think about a more complex approach to addressing systems that create and maintain that distribution of power. Again, create the systems that maintain the status quo. And that's really what Kimberly Crenshaw was advocating for. So part of this is to think about sort of the concreteness of it. And this is actually a slide that Kimberly Crenshaw often, or an image that Kimberly Crenshaw often uses in her presentations. So you think about an intersection, right? So there's a bit of a, there's some difference between the idea of intersecting ideas and intersectionality. Intersectionality is about the intersecting or the interlocking of systems of oppression to create a unique experience, and a unique experience of oppression that individuals experience. So that's important to understand. It's not necessarily about identities that we have intersecting identities. That is sort of a different idea about intersectionality, but intersectionality as it was coined by Dr. Crenshaw was really meant to really think about that unique experience of oppression that results that results from the experience of all of these different systems of oppression coming into contact and interlocking to create that unique experience of oppression. So the way we think about it from an intersection, if you will, if I were to get in a car wreck, right, and I'm in the middle, imagine I'm the white van in the middle of this intersection, right, and I were to get into a car wreck, I would have basically a accident on all sides, right? So I might I might be T-boned in one way from the left, T-boned from the right, and hit from the back, right? So I'm rear-ended. Those accidents, if you will, those crashes, they aren't additive. We don't just say like, well, they experienced a T-bone accident plus a rear ending plus a, other T-bone on the other side. That experience, that accident that I've just been in on three sides is going to create a unique impact, a unique experience, and a unique trauma, if you will, right? We don't just add those different accidents on top of each other. It creates its own set of damage. It creates its own set of harm. That unique harm that is caused by all of those things all together is what intersectionality essentially is. The unique experience of oppression, the unique experience of trauma associated with that oppression, having lived through or having gone through those various systems interlocking to create that impact. That really lends itself to this quote that I really like from Audre Lorde, who is a writer, feminist. She says that there's no such thing as a single issue struggle because we do not live single issue lives. So we think about intersectionality, again, thinking about holding privilege and oppression simultaneously. We don't live single issue lives. It's not as simple as saying, I belong to this group or I belong to this group. We have unique experiences that are a result of all of the different aspects of our identity and where we fall within the societal structure. So when we think about societal structure, we think about marginalization. I'm going to move a little quickly because I know I only have a little bit of time left. So I want to talk just briefly, this is the last set of slides on marginalization. So really, when we think about marginalization, really what we're talking about is pushing people to the margins or boundaries of society. We create, again, systems that allow us to push, or really not just allow us, but we intend to push individuals to these margins or to the boundaries of society. And by doing that, we create in-group and out-group dynamics. And then we create policies, practices, and procedures, the structure, the scaffolding, the systems that then maintain that status quo where some individuals exist on the margins. So if you think about this, we have mainstream society. We push individuals to the periphery of society based on social positioning, based on social group membership. And you see that as you get pushed further into the boundaries, you experience increased marginalization, and that inequality gradient also increases. So just sort of a schematic of how marginalization works. So when we think about marginalized identities, this is what we're really talking about, sort of the process of it. So we have a responsibility to respond to marginalization and injustice. And we have to do that within behavioral health because behavioral health system, again, not necessarily designed to deliver equitable behavioral health resources to all groups at this stage. So what's next? So today we talked a lot about reflection, our own individual sort of reflection on these concepts. Now we're going to really talk about sort of what the next step is in trying to promote social justice and behavioral health. And that's really centering the voices and experiences of the marginalized. And we're going to talk about strategies and tools for clinical practice, community engagement, research, and advocacy that will allow us to do that. There's not going to be exhaustive. These aren't like these strategies you have to engage in, but they're going to be examples of strategies or tools that we can use, that we can implement in our practice, and we can implement in behavioral health to try and create a system that serves individuals more equitably in the pursuit of justice and liberation for all. So I'm going to go to Q&A, but again, while I'm doing the Q&A, I want to make sure we put the GPRA evaluation link up on the screen so folks can fill out the evaluations as we talk. I think we have like 8 minutes left. So I will open it up to Q&A. You can throw questions in the discussion, or I'm sorry, in the chat. And then also you can feel free to unmute yourself. Just be cognizant of peers who may also be unmuting themselves. And it looks like someone would like the link also in the chat. Priscilla, if you're able to put the GPRA link in the chat as well.
I just did.
Thank you. Awesome. You're always one step ahead of me. All right. So again, if anyone has questions, throw them in the chat, or you can unmute yourself. But this sort of is the end of this particular session. Again, tomorrow we will focus a lot on really strategies, tools in those different domains to try and implement that will help center the voices of marginalized communities or marginalized individuals, which is really central to any work that we're trying to do in terms of social justice. We can't promote social justice without really centering and involving those voices. So. I appreciate everyone taking time to fill out the GPRA. It's very important for NALBA's purposes. And again, just allows them to continue to bring programming to you all and continue to offer different resources. As just a plug, if you have not already checked out NALBA's website, there's also links to other trainings and resources they have recorded. So please definitely check out NALBA's website for additional training, videos of trainings and different training documents and things like that that might be helpful to you all in your practices.
Thank you so much, Dr. Sampilo.
Of course.
We are going to send everyone the certificates no later than tomorrow. If you are already registered for today's sessions, which you did because you're here, you're automatically registered for tomorrow as well. But if you have any questions, I am completely available to help you. Just send me an email. There are some comments here, Dr. Sampilo. I don't know if you want to cover.
Sure. Shauna had again, I apologize if I'm mispronouncing your name. Not a question, but a comment. I want to thank some of the women of color in my group who shared their stories and expressed a sense of frustration and exhaustion on some of these topics. Your stories and other stories have been a huge part of my evolution as a person. They are not unseen and they do make a difference, even if so many of our systems have not yet caught up. Absolutely. And that's part of the, part of the burden that frankly, people who have identities that are part of that target group, right? Or experience marginalization or experience oppression, that burden that they carry. And that's why it's really helpful that I think a lot of you have registered for the series to be able to address some of these issues and topics and talk about them in a way that doesn't necessarily burden the individuals who have those identities. And I myself, experience that to some extent. I think what's important for me in terms of my own, thinking about this in terms of sometimes the burden it feels, what's helpful for me is to understand that I don't have to share all the time, right? That's not my responsibility or my job. And I have colleagues who will then sort of step up. And that's what I really appreciate. And sometimes it really just takes individuals who are seeking out the education, seeking out the ability to reflect, seek out those opportunities to be able to do that. And I think that's important. If anything, you walk away with something from today's session, I hope that folks who generally aren't used to talking about these topics feel a little bit more comfortable, or have some of the terminology and the concepts that make them feel a little bit more comfortable talking about these issues or raising these issues, where it doesn't necessarily have to fall on the individuals of color, because I think that's what we want to move away from. I'm always cognizant of also letting folks of color take the lead where they want to. So I think that's also important, is to not necessarily always feel like that individuals, BIPOC individuals, or any individual who shares one of those oppressed identities, sometimes they want to have some leadership and centering, right? Their voices are centered. And so I always try and be mindful of that as well. Not assume burden, but also be cognizant of the possibility, certainly of burden, while also trying to give them the opportunity to lead where they feel like they want to lead. I have some colleagues who want to lead in this work, right? They are, they have diagnosis of disabilities. They are LGBT, they belong to LGBTQ plus community. And so they want to lead because they want their voice to enact change. They want to be critical and central to that systems change. And I try to ensure that that also is elevated and that also is considered. But it's definitely something where we have to be cognizant of both burden and then also centering voices and doing it in a way that is sensitive and frankly, not just sensitive, but also intentional about how do we utilize their voices in a way that feels good to them, while also doing what we need to do to change systems. So I appreciate that comment. Thank you. Any other reminders, Priscilla, for tomorrow?
No, if you just want to move forward, Dr. Sampilo, with the slides,
Oh, yeah.
I don't know if that is any reminder left. I think we just, another plug for our conference. If you are not registered yet, we highly recommend you to do so. Dr. Sampilo is one of our presenters. We're very excited to have this conference happening next month in Las Vegas. If you're not able to join, we appreciate you if you can share with your colleagues and people that you think that may benefit from this event. And on the next slides, we just added our contact information. So in case you have any questions or you want to request training or technical assistance, you can reach out to the ATTC or the PTTC, and we are available to serve you and support your efforts. We see you tomorrow. We appreciate your patience. I think we had some changes on the link, so we appreciate you joining today's session, and we try to make things more, to give you opportunity to exchange some of your thoughts and learning in the breakout rooms. So that's why we changed the link, but we appreciate your patience and your willingness to participate on those discussions as well. See you tomorrow. If you have any questions, please just send me an email and I'm happy to support you.
Thank you all.